Esophagoscopy. Moderate sedation is often used to perform an esophagoscopy procedure. Gastroenteritis. Diarrhea, vomiting, and abdominal pain are all common symptoms of gastroenteritis. Rectocele. When the patient complained of pelvic pressure, a gynecologist examined and revealed a rectocele diagnosis. Arteriosclerosis. The patient immediately underwent a healthier lifestyle change after her arteriosclerosis diagnosis. Callopathy. Beta blocker therapy is a common treatment to help stabilize callopathy in a patient. Ileostomy. An ileostomy was performed to divert waste from the body into an external pouch. Gingivectomy. The periodontist performed a gingivectomy procedure to treat the patient's diseased gum tissue. Pancreatectomy. After a diagnosis of pancreatic cancer, the oncologist recommended a total pancreatectomy to the patient. Pancreatolysis. Impaired ability of the pancreas to produce digestive enzymes can be a result of pancreatolysis. Bradykinesia. One of the major symptoms of Parkinson's disease is bradykinesia. Narcolepsy. Stimulants are a possible treatment to help with the daytime sleepiness that comes with narcolepsy, although there is no cure. Esotropia. When the ophthalmologist saw the infant with both eyes turned inward, he instantly knew she had esotropia. Dyspnea. Those who contracted COVID-19 also suffered from dyspnea, coughing, and allergy-like symptoms. Positron emission tomography. Glucose is injected into a vein during a positron emission tomography to trace bodily activity. Cephalectomy. A cephalectomy procedure is also known as decapitation. Arthroplasty. The patient underwent an arthroplasty after years of suffering with a damaged knee joint. Tracheostomy. While the patient's airway was recovering from surgery, a tracheostomy was required to help with breathing. Cardiomegaly. The doctor diagnosed the patient with cardiomegaly after an X-ray revealed an enlarged heart. Cephalalgia. The patient complained of cephalalgia after staring at her computer screen for too long. Retinopathy. The doctor explained to the patient that if left untreated, their retinopathy may lead to permanent blindness. Adenopathy. The doctor ordered further testing after seeing noticeable adenopathy in the patient's neck to rule out lymphoma. Hemolysis. Lab results showed signs of hemolysis, so a blood transfusion was ordered for the patient. Osteotomy. An osteotomy was performed to relieve the pain in the patient's misaligned hip bone. Carcinogenesis. Smoking is a leading factor to carcinogenesis, as it accelerates cancer formation. Bronchoscopy. The doctor performed a bronchoscopy to check for infection in the patient's airways. Dysphagia. The patient came in with difficulty swallowing his food and drinks. He was later diagnosed with dysphagia. Tachypnea. Tachypnea is abnormally rapid breathing and can sometimes be present during a panic attack. Sigmoidoscopy. The doctor ordered a sigmoidoscopy to check for colon cancer after the patient had persistent abdominal pain. Hepatomegaly. After imaging revealed an enlarged liver, the patient was diagnosed with hepatomegaly. Pancreatoma. After the biopsy, the diagnosis of pancreatoma was confirmed.